Hello, Kowai Post viewers. Today we are going to be talking about sports injuries. And very interestingly, the doctors at the Royal Care Hospital tell us that most homemakers come with tennis elbow. Tennis elbow and homemakers. Are you wondering why? Let's ask them. So we have with us today Dr. C. Karthikeyan, the consultant orthopedic surgeon, and Dr. S. Nurul, the consultant in physical medicine and rehabilitation and sports medicine, talking to us today. Doctor, so tell me about this homemakers and tennis elbow. How is that?
All right, the homemakers who do household work, they do some repetitive actions.
Okay. Just like tennis
yeah,
players.
exactly. Yeah, tennis elbow is due to some kind of a repetitive movement.
Okay.
Similarly, the tissue gets involved with the repetitive loading of a household work like cleaning vessels.
Okay.
And that's how they develop this tennis elbow. And there's something called golfer's elbow, which is similar to the tennis elbow but slightly a different location. This can also happen with the repetitive movements.
That is again the elbow.
Yes, in the elbow. The tennis elbow is on the outer side, the golfer's elbow is on the inner side.
Okay.
It usually happens in the golfers when they swing their club and they hit the ground, and the rebound forces acts on the elbow, and the tissue that's attached to the bone, the muscle tendons that are attached to the bone, gets affected and it gets inflamed.
Okay.
And this causes pain during certain movements.
So this happens only among the golfers, or just like the tennis elbow, it happens to others as well?
It also happens in people like plumbers, painters,
Okay.
who do repetitive movement.
Okay.
And not necessarily only during repetitive movement. You hit your elbow against the door,
Right.
and there's a direct impact on that particular spot. This also causes tennis elbow.
Okay. Okay. So my next question is to Dr. Karthikeyan. Doc, you tell me, how about knee? The jumping knee, you're saying that you're seeing it among women who, practice Zumba. So Zumba is something that's catching up and which is, very sought after by women. You see a lot of fitness centers which offer Zumba. So what exactly happens, and what kind of patients what kind of patients come to you?
Yeah, so the jumper's knee actually indicates the inflammation of the tendon around the knees,
Okay.
the patellar tendon around the knee. So when they jump and land down, so the stress
Tendon is the tissue?
tendon is a tissue between the patella, there is a kneecap,
Okay.
and the tibial bone here, just
Okay.
beneath the knee. So the tissue connecting
The kneecap and the bone.
and the bone. So
Okay.
that is the patella.
Okay.
So there is an inflammation of that tendon. So whenever they jump and land down, the amount of force that is borne on that tendon is more. So over a period of time, due to repetitive movements, they get inflammation in that tendon. So this not only happens in jumpers like gymnasts or athletes, but also in common people who in an enthusiasm go to the gym and they want to reduce weight overnight, so they do a long hour of Zumba,
exercise.
and the next day they come to our clinics with knee pain.
Okay.
So that's how they get the jumper's knee.
Okay. So, doctor, coming back to you, why do you think sports medicine has gained a lot of importance as of the current day?
Well, people are getting more conscious about their health, more importantly their fitness, and the sports is catching up as a fad. So people take up running, they take up cycling, they take up various other sports, but the problem is they don't understand that to have a good enjoyable sport, they should have adequate fitness for it. So without proper fitness for a particular sport, if one is entering a sport, that could cause some overload or overuse injuries.
So, what would you suggest, doctor? What would you advise? Go slow? Is that the mantra?
I would suggest initially a person, if they have to take a sport, for example cycling, there are a lot of factors like the seat to cleat height, the position of the seat, whether how far it should be in front and back, depending upon the individual's body measurements. The measurements in cycle also has to be adjusted. If it is perfectly adjusted so that there is no overloading of a certain part of the body, then the likelihood of getting overuse injuries are minimal.
Okay.
The overuse injuries are predominantly due to misdirected forces rather than properly directed forces. So we should make sure that the forces are properly directed during a certain sport. And if a person is strong enough to take that load, then the chances of injuries are less. So I would suggest a person should have a proper training, proper knowledge and preparation before they enter the sport.
Okay.
I'd like to add a few more points. Why sports injuries are becoming more common nowadays? As we all know, the number of non-communicable diseases are increasing, like
Right.
diabetes, hypertension and cardiovascular problems. So the prime reason for all this is physical inactivity. In
Absolutely.
2018, in Times of India, there was a survey which said that around 54% of Indians don't do any other physical activity. So they said only about 10% of Indians do recreational physical activity apart from their jobs. So there is a lot of physical inactivity. So people are coming to recognize this, and then they want to improve their
Right.
lifestyle. So now if you see the Coimbatore Marathon itself, the last 2 years there's been an increase in almost 10% of participation.
Absolutely. Yeah.
So people want to enter more into physical activities,
But
into
they do
sports.
it in a haste.
Yeah, that's what Dr. Noorul was telling exactly. Before they build up their body to take up that kind of stress, they jump in and do a lot of activities. So that's why we are now seeing a lot of sports injuries.
Okay. Doctor, could you also tell us about the advancement in sports medicine now that you've been doing a lot of
Yeah.
sports related
So,
surgeries?
in fact, this is one of the specialities that is growing by leaps and bounds actually throughout the world. Me being a surgeon, the keyhole surgeries or the arthroscopic surgeries are have actually revolutionized the treatment of sports injuries and have helped many an athlete throughout the world to get back to their sports. Actually, for if we consider the knee, the common injuries of the knee are the anterior cruciate ligament injuries or the meniscal injuries that are now being.
Doctor, could you simplify that?
These are small ligaments between the thigh bone and the leg bone that are helpful in the normal biomechanics or movements of the knee.
Okay.
So in a sport injury, the ligament called the anterior cruciate ligament between the thigh bone and the leg bone, and meniscus that acts as a cushion between these bones
Okay.
get torn.
Okay.
So these are the common ligament injuries that can happen. So a keyhole surgery by which we treat these ligament injuries, and the patients have a good post-operative recovery after the surgery, and they go back to rehab faster, and they are even able to get back to their sports within 6 months. So that is one of the major advancements with pertaining to ligament injuries of the knees and the shoulder. And the other advancements that are happening is related to the biologics, that because most common injuries that happen are the musculotendinous injuries in sports of the muscles and the tendons. So these tissues have a poor capacity to heal by themselves. That's why they become chronic injuries and affect the life of a sports person. So how do we treat them? The recent advances are through platelet rich plasma therapy or stem cell therapy,
Okay.
which are the biological ways of treating these injuries. So I think keyhole surgery and biologicals are now revolutionizing the treatments of sports injuries.
Okay. So Dr. Noorul, could you tell us a little bit about ankle? I think ankle sprain is something that you would be seeing most often. So could you elaborate on that?
Yes, ankle sprain is very common in sports like basketball, where people jump and land and then they hit on someone and then they sprain the ankle. It's common among runners when they when they trip and they sustain ankle inversion, among footballers, in many such sports which involves running, tackling, sudden change in directions and all those things. Now, what normally people do is when they get ankle injuries, they tend to take rest from the sport, say for about a month or so, and then they go back to the sport without proper rehabilitation. And this is where they end up in trouble. They sustain another injury because the ankle after rest becomes deconditioned. Our body, our muscles become deconditioned after rest, and they have to recondition again to take the rigors of sport. And this is where the rehabilitation comes in. And if this rehabilitation is not done properly, they're likely to sustain recurrent injuries.
And most often, most people don't take rehabilitation seriously.
Yes, they tend to ignore that,
Yeah.
and they keep coming with recurrent injuries.
Yeah, okay. So, Dr. Karthikeyan, could you tell us a little about how surgery and rehabilitation goes hand in hand?
Yeah, good question. Especially in a field like sports injuries, we always work as a team. So the team comprises of a surgeon, a sports physician with a sports physiotherapist, and whenever needed we take the help of a sports nutritionist and a psychologist also.
Okay.
And this is where Royal Care, I think, is unique in the sense we have an entire team of professionals working to focus on sports injuries.
Okay.
And we have the infrastructure to treat sports injuries, and the rehabilitation needs a good fitness center and good biomechanical laboratories. All that is with us. So we have a good team to treat sport injuries, and most of the sports injuries, as we had touched upon, rehab forms almost 50% of the success.
Right.
So I think it is overall a teamwork.
So, doctor, could you advise on what one needs to do to prevent these kind of injuries?
The most important is proper warm-up and proper cool-down. People don't do proper stretching and they end up in getting muscle and tendon injuries. So there are ways to stretch, and people should know how to stretch each group of muscles for certain sports, and how to do the dynamic stretching before the sports, which is called the warm-up, and the sustained stretching following the sports, which is called the cool down. This would prevent many injuries related to muscle and tendon.
Okay. So, doctor, if you could highlight upon once somebody is down with a sports injury, what should one do?
Yeah. So once somebody is really down with an injury, the immediate first aid or the emergency treatment that can be done is shortly abbreviated as RICE. So R is for rest. They should immediately rest the injured portion of the body, and I is for ice. They should apply a lot of ice packs over the injured portion, and C is for compression. Just apply a crepe bandage compression at that area to prevent the swelling from getting more, and last E is for elevation.
Okay.
Is to keep the injured portion elevated so that the swelling doesn't increase.
I would like to add a couple of more to that. P in front of RICE, which is called price. P is for protection, and finally D is for drugs. So prized.
Okay.
Yeah.
So your body is a prized possession,
Right.
so you should
Please
take care of it.
Okay. Thank you so much for talking to us, doctors. Thank you.
Thank you.